we're going to go over the 2010 BLS infant choking guidelines. And here we have little Sally with us today. We're going to pretend that she's having a problem swallowing her food, which most children at her age do have. And where are they when they start having problems swallowing their food? They're in their high chair, or they're in their 5-point harness in the back of the car seat. You know, it takes a long time for us to get to them before we can actually do our skills that we need to perform our choking maneuver. So today, Sally's sitting upright and she's eating on some Cheerios. And she starts giving that sound like babies love to do. And she doesn't stop. Her eyes are open, they're blinking. She's just sitting here having a good old time. You can tell just by looking at her, she's got something going wrong. Whether she's slobbering more, drooling more, she just can't get it out. So what we're going to do for Miss Sally here is we're going to get her off her chair, and we can either, and it's your preference, whether you want to start with abdominal thrusts or if you want to start with back blows, it's a total preference thing. And of course, with infants, we have to support their head. That's the most important. We're going to keep her head down for gravity, and we're going to give her 5 back blows. We're hoping for the best here. 5 abdominal thrusts. And we're going to look to see what we have. If we can visually see it in her mouth, we are able to grab it and pull it out. If we can't visually see it, we have to keep going with this tactic, which is 5 abdominal thrusts, and you have to use the heel of your hand, and you're using a force. You need to put pressure on her abdomen so we can get that air up there so we can dislodge what she was choking on. And we're going to do this numerous times until little baby Sally here can get what she was choking on out. Now she is going to be crying, and her airway is going to be patent, but we got to be able to see it to get it out. And with babies, it may be on their bib, it may be on their outfit, it could just be on your shoe, it could be on the floor. They don't have the mechanisms like us do as adults to really get it projectile farther out. So we're going to do 5 abdominal thrusts and 5 back blows. We're keeping her head down, and we're supporting her head until we can get and see the object and remove it. In the event Sally should go unresponsive, and you know when a baby goes unresponsive because their whole body will go limp. They're no longer crying, they're no longer making eye contact, their whole body goes limp. So we have to start with the whole BLS sequence. We gotta check for responsiveness, we gotta check for breathing, we're checking for a pulse, we're calling for help, we're asking for the AED, and we're gonna begin chest compressions. Again, chest compressions, me being a single rescuer, would be 30 to 2. Until if we were very lucky, hopefully with doing chest compressions, we were able to dislodge what she was choking on. If that doesn't work, hopefully by just doing the head tilt and giving her 2 breaths, we were able to move the object out of her throat and have her airway open up that way. If not, we're going to continuously do this until 911 or your EMS system comes. Thank you.